2, 1. All right. Hello, everyone. Thank you for joining us this morning. My name is Jasmine, and I am the Y.E.S coordinator here at the North Suburban YMCA. It is my pleasure to welcome you to Heal Low Back Pain and Sciatica by Denise Schwartz, licensed physical therapist and owner of the Manual Touch Physical Therapy in Wheeling. Today, she'll be discussing the causes of low back pain and how to deal with that pain naturally. We'll be recording today's session to make it available as a podcast on our Y.E.S website. So if you are a Y member, you'll be able to reference it down the road as well. The YMCA Education Series program typically lasts an hour. Denise will take questions both during and at the end of her presentation. If everyone could mute themselves during the presentation so that background noise doesn't interfere with the presentation, you can then unmute yourself when she opens the forum for questions. The YMCA Education Series is free and open to the public, but as a nonprofit organization, we are always happy to receive donations from you. If you enjoyed today's program and would like to support adult programming at the North Suburban YMCA, please feel free to make a donation to our Y by going to our website. Again, thank you for joining us today, and a special thank you to Denise. Now, I will let Denise talk to you about dealing with low back pain and sciatica. Please welcome Denise.
Thank you, Jasmine. Always happy to be here. I think some people aren't fully muted. And, I gotta share my screen. Oh, there it is. Hold on a second. Okay. All right, now you should see my screen. I think you still see me, right?
Yes.
Okay. But hi, everyone. I'm Denise. Thank you, Jasmine, for having me. I love doing these programs. I have blanked out everybody, so I can't see you. I can't see myself. So if you do have a question, you can put it in the chat box, or if you don't know how to do that, write it down. And then at the end, I will take questions. Unfortunately, in these webinars, it's hard to do questions during the program because I don't see anybody and I'm only looking at my screen here. So, okay. And I think we'll get started. Again, Jasmine said, I'm Denise Schwartz. I am the owner of the Manual Touch Physical Therapy in Wheeling. We use a whole body approach at getting people back doing the things that they love to do. So I'd like to start off with a little story. My son, right here, who is now married and 29, and he'll be married 2 years. A couple years after college, he came to me and asked me, Mom, can you help me get over my injury so I can get back to doing racing triathlons? Now, Drew began doing his triathlons at age 14, and he soon was winning his age group in every race he entered. He even competed at the junior elite level when he was in high school and nationally ranked at the collegiate level. But upon graduation from college, he had a couple of injuries. He took a couple of years off. He also needed to get used to being an adult schedule as opposed to a college student. So I was really pleased when he came to me and said if I asked him if I could help him. He decided to make his return at the Pleasant Prairie race in Wisconsin. He would swim half a mile in a small lake, bike 12 miles, and then run a 5K, 3.1 miles. So the first thing we did, and that's my daughter. She was the best man. The first thing we did was we put him on the treadmill to watch his running form. I analyzed his gait. I gave him some running form tips. I gave him some exercises to do. I did some hands-on work to get him through whatever aches or pains he had. But really, the biggest thing I did for him was provide him with the kind of support and reassurance that he needed as he went through kind of an emotional journey of returning to doing racing in a triathlon. Many a night I'd get a call, Mom, my calf hurts, I can't run. Or, Mom, now my hip hurts, I don't know what I should do. And I'd have to talk him off the ledge and talk him through, adjust his training if need be, or tell him, it's fine, this is normal, you can keep doing that. He did make it to race day. Let's see. Let's see if we do this. So this is the beginning of a race where a bunch of Junior elite athletes are jumping into the water, swimming over each other. And there's, biking and running. So, what's unique about the Pleasant Prairie race is they attracted a lot of para athletes, athletes with disabilities. Here you can see an athlete biking with a prosthesis. This athlete is biking without his prosthesis. Here's somebody tethered to somebody possibly for vision. This person may not, the para athlete might not be able to see. This definitely, the para athlete needs a set of eyes, so they're back here. I saw people being carried into the water because they couldn't walk, but they could still swim. As I'm watching these athletes as they come across the finish line, it occurred to me that a para-athlete or athlete, they all looked the same. They all looked joyful and excited that they accomplished this major goal. It didn't matter that they might have had a disability or not. And I think back to when I see people like my son with an injury or my patients when they have an injury, they go through an emotional process of, oh, I can't do something, or how am I going to get back to this? And I'm sure these para athletes went through an emotional journey as well, whether they were born with a disability or it came on later in life. When somebody becomes disabled, the first things you're not thinking about doing a triathlon, but you're worried about, how am I gonna get from a chair to the bed, or how do I get on the toilet, or how do I get dressed? But eventually, as they get used to doing their everyday activities and they're out of pain and they're adjusting, these patients went through a process where they accepted who they were, who they are, who their body, where the body is now, but they didn't let that disability or injury define them or limit them. They worked with it and they created a new reality for themselves, and they can set new goals, such as racing a triathlon. So, at the beginning of anybody's rehab process, it's hard to imagine that you might be down the road being able to do something that you love to do. But more than likely, you can get there. You keep working at it and we through the process, and you accept where you're at, and you might need to shift, but that's okay. So maybe a triathlon isn't your goal. Maybe you just want to be able to walk without pain. Maybe you want to get back to your favorite activity, such as golf. Or just be able to visit with people and cook and stand and cook, because that can be a problem. All right. So today we're talking about low back pain. It is the most common reason people go to their doctor. They have low back pain or sciatica, which is pain down the back of their leg. And we're going to talk about the three most common diagnoses that I see in physical therapy. And then I'm going to talk about a fourth diagnosis that everybody has, and sometimes that's all they have. But it's not an official medical diagnosis. It's a functional diagnosis. We're going to talk a little bit about anatomy, and then we're going to talk about what you can do about it. So when somebody has back pain or leg pain, there are a variety of complaints or issues they might have. They may have back pain all the time, no matter what position they're in. They might have back pain only when they're sitting or only when they're standing, and then they sit down and they're fine. People will tell me they walk or stand for 10 minutes and then leg pain starts. And then if they sit down, it goes away, they rest, and they can get up and go again. That tells me something about what's going on. Some people have back pain when they bend over. Some people don't when they bend over. Driving, rolling over in bed, going from sit to stand. People may have pain in their mid back, the right side of the back, the left side of the back, in their butt, down the back of their leg, down in their ankle or their foot, and it all could be coming from their back. A very common thing I hear, particular for my patients as they get older, maybe over the age of 75 or over 70. They have pain or stiffness first thing in the morning, and then as soon as they start moving and they get going, it's not so bad. It's manageable. When we hear that, we sort of have an idea of what's going on. So the three common diagnoses that we're going to discuss is a herniated disc, also known as a bulging disc or a slip disc, um, arthritis, which can also be called degenerative disc disease. It could be in the lumbar spine or the foramina. We're going to talk about what that means. Stenosis is a form of arthritis. And then the third one is sacroiliac joint dysfunction. And then the fourth one that everybody has, but sometimes they don't have any of these things or anything that they might see on an image, but this is all they have: postural weakness and or immobility. Usually they go hand in hand. So I had a young man come to me in his 30s, and when he sat down, he just slumped over. He couldn't even sit up straight. When I asked him to sit up straight, he couldn't do it for more than a handful of seconds. And he sat at a desk all day long, on a computer with his job. But he didn't have any of the signs or symptoms of arthritis, stenosis, a disc problem, SI joint problem. It was literally because he was weak. His whole core and trunk were weak. So I saw him for a couple of months, gave him some exercises. He did what he needed to do at home. I got a better understanding of how he's supposed to sit and how he's supposed to stand and walk. And he's doing really well. I think he came to me a couple years later for a tune-up, and he's been doing pretty well. So this is a real thing. Weakness can cause pain. Uh, I got this weird thing on my screen. Jasmine, if you're there, can you see on the top of my screen that it says, I hear your voice in my head?
I see sometimes I hear your voice in my head.
You can see it? Okay.
Yes.
I have this taskbar up there about, and then I can't get rid of it. So all
Yeah.
right. I hear your voice in my head. So a lot of my patients have been doing this a really long time. I've been a PT since 1988. I started working in a hospital, and then I worked for another company for a while, and then I opened my own practice 16 years ago. And so people come back to me because people are still active and moving around and they get injured again. And they tell me they hear my voice in their head. At first, I'm like, oh, I'm sorry, but really, that's great because people are taking my advice. And what I like about this picture is this man is using really good posture. His back is in good alignment. He's hinging through his hips. He's not bending over in his back. And his body is turned towards, I'm going to assume, his daughter, as opposed to twisting in his back. So some of the things that actually a majority of the things we do here in physical therapies teach you how to move and function doing everyday activities so you don't aggravate yourself or you don't re-injure the area. And if you want to learn more of those tips, I have an ebook like this on my website. Or if you put your first and last name and your email in the chat box, I will send you a link for this ebook. All right, so let's get to some anatomy here. Here is your skeleton. What we're talking about today is this part of your back, which is known as the lumbar spine. And I wanted to show the whole skeleton because people forget that everything is connected. So if you have a back problem or back pain, sometimes it's because your feet aren't doing what they're supposed to do. Or maybe you have a problem up here. I get a lot of people who've had mastectomies or some lung surgery or some scar tissue up here that tightens everything up and shortens their trunk. And so it throws off their back. Okay. So it's really important to remember the old kid song, the shin bone's connected to the foot bone, connected to the hip bone. It's true. So it's really important that everything is addressed. Okay, so here is a side view of your spine. This is the lumbar spine. There are 5 vertebrae. And then you have your mid back called your thoracic vertebrae. There's 12 of those. And then 7 cervical vertebrae in your neck. Down here is the pelvis. Yeah, this is better. Okay. Your pelvis. All right. You got your pelvic bones. Down below is your sacrum, just below the lumbar spine. You can see these bone, this is kind of yellowish. That's the bones. Those are your vertebrae. In between the vertebrae, this is called the body of the vertebrae. You can see this is the belly, and this is your back. There's your discs. And then through all those vertebrae is a hole called the spinal canal that your spine goes down. And off of the spine, in between each vertebrae, is a nerve, and it goes through a hole, which is called a foramina. So those of you who have had MRIs before and are diagnosed with a foraminal stenosis, this is where it is. This foramen gets arthritic, which means a buildup of the bone, and it begins to impinge the nerve as it's coming out between the vertebrae. If you have spinal stenosis, I guess this is the best picture, then that canal is a little narrower. Stenosis means narrow, okay? If you have a herniated disc, here's the disc in there. There's a little pink thing there showing a herniation. It really doesn't look like that. So the disc is like a jelly-filled donut. Inside the middle of the disc is a nucleus. And what happens is when you injure yourself, that nucleus kind of opens up and it causes pressure on the outside of the disc, which is actually a ligament called your annulus. And that pressure bulges and hits this nerve, which, the nerve coming out of between 5S1, and sacrum all come together to create that sciatic nerve. It is the largest nerve in your body, and it goes down, starts in your spine, comes out behind your buttock, down the back of your leg, and then it splits down behind your knee and it heads down to the outside of your foot. I thought there was something I wanted to say. So I'm going to go back. So we were talking about stenosis. So when people have stenosis, even if you don't have an MRI, we can pretty much diagnose probably what's going on by what you tell us. Stenosis, the classic stenosis shows up as I can't stand or walk greater than 10 minutes, and then both my legs hurt. Could be the front of the thighs, the back of the legs. My legs feel fatigued or tired. That is classic stenosis complaint. These people find relief by bending over and flexing. So people who maybe bend over a shopping cart or a walker and they're flexed, it's because they're taking some of that pressure off of that canal. It is more than likely stenosis. If it's foraminal stenosis, it's usually a little bit more one-sided. It's very hard to resolve and find a comfortable position. So that's a little more challenging. Somebody with a disc problem, when they bend over, they have increased pain. They will tell me it hurts more when I sit as opposed to standing. Walking isn't so bad. If I lay on one side, the pain goes away, but if I lay on the other side. So when we ask you these questions of what's going on, it's really important because it helps us know what probably is happening in your spine and how to best treat it. Back to anatomy. This is your pelvis. This is the sacrum. Your pelvis is made up into 3 bones that are, adhered together. This is called the ilium. So this joint is called your sacroiliac joint. It moves a minuscule amount, but think about like when women are pregnant, it opens up. Okay, so it does move. However, so when people come to me and say, oh, it feels like something is stuck, when I lay on it, it hurts. When I cross my legs, it hurts. We usually think of it as an SI joint problem. Now, if you can visualize, I don't have a good picture of it. Let me see something here. So if here's your pelvis, if the SI joint is shifted a little bit like this, it will pull, it'll strain the muscles here, which might compress the sciatic nerve. So you might get pain down the back of your leg or somewhere in your leg, and it may not be a problem in the spine. It may just be something here. So those are things that we're going to look at. Quite often, even if somebody has a problem here, I find this problem as well. And then once we sort of get this opened up, think about when you get something stuck in your tooth and it's just achy. Advil isn't going to help. Tylenol isn't going to help. Codeine isn't going to help. You have to just get that piece out of there. It's kind of similar with this SI joint. When something, every joint should have what we call joint play. So if you look at my finger, I can raise it up like, this high, but there's give in it like this, and it should move in all directions. But if it's a little bit stuck in one way, it doesn't have full joint play. And that's what's happening here. Something is a little sticky or stiff. And so it doesn't allow you to move as optimally as you need to, and then you keep irritating it. So we need to get in there and mobilize that joint so it can get that full motion it needs. We talked about weakness. A lot of people when they come in, they have weakness in the hip, pelvic floor, and core muscles, which will affect your back. So this is your deep pelvic floor muscles. These guys here make up your pelvic floor or deep core. They sit and they kind of create a sling, if you will, holding in everything. And they rotate your legs. So if you go to bring your leg up to onto your other knee to put a shoe on, that's these muscles. Okay. And a lot of people are really weak, very, very weak here. So sometimes I get people coming in and they have pain here on the hip. It's because they're so weak here, they're not doing their job. They overuse these muscles, and then these get fatigued and strained, and you get weakness there too. So we need to look at all of that. That's in my hip lecture, my hip webinar that I think you can still find on my website and on the YouTube channel. This is important to see. Don't tell iStock. Um, there are a lot of muscles. Remember the skeleton and the pelvis? There are a lot of muscles that attach in the front and in the back. In the front, you've got your quads, those big thigh muscles. You have an IT band. You've got the gracilis, which is probably something you never heard of. And you also have a muscle that's, I don't know where it is, but anyway, there's a deep muscle sits in your abdomen that crosses here as well. So you got muscles in the front, and then you got all the hamstrings that attach to the back of the pelvis. So if you strain, so someone pulls or strains their hamstring muscle, it will pull on that pelvis. And remember how I said it could shift back like that? Which means when they go to walk, it doesn't move. When you walk, the pelvis should move like this. Um, and it's not because something's going on up here, even though you're going to have pain in your back. It's because the muscle down here that is attaching to this bone is tight. So that you can see how that hamstring muscle here, if you get a rip or a tear or a strain there, it can cause a problem. So I had two men recently with that issue. One man, Sean, he had 5 years of pain back here and here in the SI joint. And it hurt him when he sat, at work for a few hours. Uh, and what we realized is he probably strained this hamstring muscle. So we needed to release that so then his pelvis could move freely when he moved. We had to talk a lot about how to bend over and tie his shoes so the pelvis could move in an optimal way. Craig, he had had a terrible accident where he needed surgery on his leg, so he had all this scar tissue down here that was pulling on that pelvis, pulling him into a position that didn't allow it to move when he walked the way it needed to. We had to do a lot of soft tissue work on that scar tissue and give him some exercises to get that mobilized so then the pelvis can move freely. You all know what your core is? It is your every muscle from your diaphragm between to your pelvic floor in the front of your body and in the back. And they all have to work together. And that deep pelvic floor that we talked about, the hip rotators, they are also part of the core. And if these guys aren't doing their job, I tell people this is the front of your back. Let me repeat that. This is the front of your back. So if something isn't working very well here, muscular, or you have a gut issue. I will tell you, everybody who has a significant gut issue, colitis, ulcerative colitis, Crohn's, IBS, almost always will have back pain because they have inflammation here and it affects their back. So it's something that needs to be addressed both ways. All right, if you have any questions about anatomy, please put it in the chat box and let me know. We're going to move on to posture. This is a nice picture showing how everybody has different posture. And I do have a little pet peeve. I get a lot of people telling me, oh, my posture's terrible. Oh, my wife tells me to stand up straighter. She says I have bad posture. Um, I'm sure there's, oh, my mother told me to throw my shoulders back to sit up straight. They are all well-meaning, but they're telling you that you are the problem, and oftentimes you are not the problem. Our spine optimally should look like this: a curve in, curve out, curve in. But we go through puberty, we get injured, we gain weight, we lose muscle mass and bone mass as we get older. And the spine, your discs in your spine start losing fluid in our 20s. Your spine changes and it has nothing to do with you. Now, if you are sitting all the time and not doing exercise, it's a little bit on you. However, the spinal changes that people have, so when someone has this kind of curve in their spine, there really isn't anything you can do about it. Or here I get men who have these really flat spines and backs and they kind of look over. It's because they're protecting their back a little bit and spine. They can't just stand up straighter until they get strong enough to stand up a little bit. But this probably isn't going to change so much. So I just want you to kind of have some grace and be kind to yourself. And let's learn what you can do to keep yourself strong and prevent it from getting too much worse. Okay. Where's, oh yeah, back to, where is that? Oh, there it is. Okay. I'm thinking about it, so I'm going to tell you now. One thing that I've been noticing a lot with patients is because we've all taught, I don't want to look hunched over like my grandmother or my mother. So I sit up really straight and I throw my shoulders back. And you know what? What they're really doing, well, they're doing two things. Oftentimes they're bending back from here, which if you can kind of visualize will shorten these muscles in the low back, causing them to work really hard and fatigue and eventually wear out and you get injured and you're in pain. The other thing when people say I throw my shoulders back, They're not, where's my, go back to my skeleton. You're throwing your shoulders back. You're not doing anything to your spine. You're throwing your shoulder blades back. Let me tell you that again. You are not changing the curve in your spine. You are just you're moving your shoulder blades back, which then puts your shoulder joint in a poor position to function. And then you wind up with some shoulder injury. So 9 times out of 10, I'm telling people to not put their shoulder blades back, to actually let it relax and almost come forward a little bit. And I'm also telling people to lower their chest forward so they're here. So those are a couple of tips you can do right now. Is if you're standing, I know I was cooking for Thanksgiving a couple of years ago, and I'm one of those lucky people that I don't have back pain on a typical basis. And all of a sudden my back was sore after cooking for a couple of hours. I thought it was odd, but I'm short, and so I think in order to see what I was doing and whatever cutting, I was bending backwards a little bit here. And once I sort of settled forward a little bit more here, these muscles could just work the way they're supposed to and not get overworked. So it's a nice tip for you. Okay. Yeah, we talked, so this is just a little graphic. If one of these rocks is out of place, it all comes tumbling down. So if there's a weakness or a problem somewhere in your body, it's all connected. So we have to look at all that. It's all connected. Yeah, after we're done here, I'm going to send this PowerPoint to Jasmine, and she can send it to you. But if you'd like to get it, or you can put your first and last name and your email in my chat box, and I'll also send you a copy of it. So you can see the summary of uh, what we talked about. So in summary, if you have a herniated or bulging disc, it hurts when you bend over. You have increased pain or symptoms bending over, sitting. Oftentimes people look kind of like side bent. Stenosis, whether it's in the lumbar spine or in the foramina. Usually you have the pain in your legs after standing or walking for 10 minutes, and bending over usually feels better. The SI joint, it hurts laying on your back. It feels kind of stuck. And maybe when we test your side bending, we'll feel an impingement there. I discussed a little bit about the postural weakness and immobility. Very important to keep your strength up and do some exercises for your core. And I'm going to talk about that a little bit later, and keep yourself mobile. All right. We have to talk about it. Everybody ages, and there are changes that go on in our bodies when we age. It just is the way it is. And kind of like those para athletes in the triathlon, at some point, in order to compete at that level, they had to accept their new body, and they don't let it define them, and they figure out what they can and can't do with it, and they work with it. As we age, we have to learn how to work and accept that our body is aging. It's better than the alternative, and we work with it. Our bodies all go through loss of muscle mass and bone mass. And as a result of that, our balance and our flexibility is impaired, and our strength. So it's really important to keep up with some balance exercises, strengthening, and mobility exercises. My friend Carney, he's 73 years old and he's still doing triathlons. He doesn't let age stop him. These ladies I met down in Florida. I was doing the Tampa half marathon maybe 10 plus years ago. And I was standing in line at Starbucks, and it must have been the longest line ever because we talked for a long time. I believe these ladies aged, this was her 80th birthday. You can see this nice happy birthday hat they made for them. And these, I don't know, they were 70, 75, something like that. They had walked the 5K that day. And later, the next day, they were going to walk the 10K, and they were going to walk the half marathon. I was just running the half marathon. I didn't do all that. But these three ladies, look how happy they are. They did not let age define them. We kept in touch, and you know what else they did? They walked across America. They started in Jacksonville, Florida. They put their toe in the Atlantic Ocean. And I think there was five or six of them. It varied over the number of days. And one person drove a van, and so they all took turns walking, but they literally walked from Jacksonville, Florida to somewhere in Texas over 4 months. They took a break for, I don't remember for how long, and then they came back and they started in Texas again and they walked to San Diego and put their toes in the Pacific Ocean. So these women didn't let age define them. They stayed healthy. And, now I'm not telling you you need to go walk across America or even walk this half marathon, but they didn't let it define them or limit them, and they figured out what they could and couldn't do. So what's the biggest mistake people make with back and sciatic, low back pain and sciatica? They ignore it. So if you have back pain, if you wait a couple days and it's not going away, then you need to take a look and see what's going on. But if you're like, oh, 2, 3 weeks later or 2 months later, you still have it, that was too long. You could probably take care of this much sooner. So, uh, you have a few choices. You can ignore it. So 2, 3 months, I've had this pain for 3 months, I didn't do anything. You can go to the doctor, which you should, and then we may provide you with medication or suggest a shot. Usually the first time around, they're not suggesting surgery. There is a place for all of this. But what would be really nice is if you came in to really learn how to handle and manage your symptoms and your pain and learn how to prevent it from getting worse and maybe taking care of it. Maybe we can get rid of it. And that's what we do in physical therapy. So how do we know if we can help you? We first want to know if your symptoms are reproducible. What does that mean? My pain only hurts when I sit down, but when I stand up, I'm okay. I only have pain after I walk for 10 minutes, and then when I sit down and I sleep, I'm fine. That is reproducible. But if what is not reproducible? So I had back pain out of nowhere 10 years ago. I went out and ran. It didn't make it worse. And after the next 3 days, it was getting worse and radiating to my abdomen. I couldn't find a comfortable position. By day 4, I couldn't sleep. So I knew it was not musculoskeletal because it was not reproducible. I went to the emergency room. They couldn't figure anything out. I went home. I had some pain meds. A week later, I scratched my back and I had a rash. So I had shingles, but I had pain before the rash showed up. So that is not something that physical therapy helps with because it's not reproducible. It's not musculoskeletal. So if we were in person, I'd say who's been to physical therapy, but since I can't see you, I'm going to talk to you about what happens when you come in. So when you come in for an evaluation, we ask you lots of questions and we want to know your full history because we want to know all the pieces that put your puzzle together and what is the missing piece that is preventing you from healing or holding you back. And this is a link to a blog post I wrote about that. Once we hear your story, and oftentimes we're the first person in the chain of healthcare providers who can sit and really listen to all that and put all those pieces together. And there's so much that goes together that we have to remember, like somebody goes in for back pain, but like Craig and Sean, that was really because they had their hamstring was strained, but their hamstring wasn't bothering them so much at the time, but their back was hurting. So the doctor may not have had time to hear the whole story of how those pieces went together. We check your mobility, your strength. We use some hands-on techniques to find out if there's any tender spots, and then we figure out what we believe is causing the problem, and the diagnosis. And we work on the mechanics to make sure your body's moving the way it's supposed to. We give you some exercises to improve your mobility, your balance, and your strength. And most importantly, we teach your body how to work together, called neuromuscular reeducation. A lot of times, particularly with back pain, it has to do with what's going on down in your ankles. I have a lovingly pet name for what happens to people as they get older. They get old man ankles, where their ankles become really rigid and they don't move. And so you think about it, if your ankles can't do what they're supposed to do and you turn suddenly, you could fall over really easily. If those ankles don't allow you to turn, then somewhere it has to turn, and oftentimes it's in your back. So it's very important to look at all those different pieces. And then we'll look at shoes to make sure you're in the best shoes to protect you. My friend Danny had hip and back pain, and his wife threatened him that if he didn't come in to see me, they weren't going on their vacation to Utah because he had hip and back pain after walking 20 minutes. And he was bike rider, he exercised regularly, but when he came in, his posture, not sure posture, his mechanics, the way he was walking was really funky. He had some weakness. So we had to work on really re-educating him how to walk properly and how to use all the muscles together. And I think, I don't know, probably within 4 to 6 weeks, things were shifting and he made it on his trip and he now can walk without hip and back pain. I don't give out exercises here because depending on what's going on, some exercises are appropriate for one diagnosis, but not appropriate for another. And then of course, there are things that you can do that everybody can do regardless. Imaging, I'm asked often, why didn't I get an MRI? Well, because as we talked before, usually your subjective complaints, what you tell us, and then our evaluation, either with the doctor and with mine together, we can figure out what's going on. And the only reason you really need an MRI, they might do an X-ray because you want to rule out if there's a fracture, and I think you can see tumors and stuff on an X-ray. So, so they're looking for the worst. And if that's clear, then an MRI really isn't needed unless you're not progressing in PT. So like after 3 to 6 weeks, if things just are not getting better, or then we send you back to the doctor to get imaging. Or you're having neurological signs. And what does that mean? You might have bowel or bladder issue. Your radiating symptoms are not going away. You have decreased reflexes. One side of your body is weaker than the other. And if you started with the doctor, hopefully they saw all that stuff and they're going to get an image right away. But sometimes we'll find those pieces and we'll suggest imaging. Now, sometimes, even if you're having this, PT still can help. Sometimes they'll see something on there, they're like, oh, we need to do surgery now. But it's just another piece of the puzzle to help us figure out what's going on and why things persist. I touched a little bit on what we do. We do some hands-on techniques, some non-traditional and some traditional techniques to get every joint and tissue as healthy as it can be, strengthening, balance, and neuromuscular exercises. And here, a lot of education. How to sit properly, how to stand, how to walk, how to go from sit to stand. I had a woman this morning who had back surgery 6 weeks ago, and the way she was laying down in bed, I'm sure somebody taught her, but those weeks post-surgery, you forget stuff. She's like, oh, that feels so much better the way I showed her. How to lift, posture, which I gave you some tips about. When people go back to, I had a woman who had back surgery 5, 6 months ago, and we talked about how to garden so she wouldn't hurt herself anymore. So we go through all those things. I had a flight attendant. We talked about all the pieces that she does with her job and how to prevent the back pain. All right, one of the last things I want to talk about is one of the tools, a couple of the tools that we use here that's pretty unique to our clinic. A friend of mine introduced this to me. It's called an OOV. She uses it at her clinic. She's got a PT and Pilates clinic. It's called an OOV. It works your body three-dimensionally, so you can't compensate. You can lay on it. You can have it behind your back. You can stand on it. My son's doing an advanced technique. Here's an older gentleman, and I do this with any age, a little entry level position. It's like one of the best tools I've ever had in my career to teach people how to get their core activated without their brain. So it starts teaching your body how to work functionally. The man who created that created this device. This is to sit on. It's called a balance sit. It also activates your core and your pelvic floor. It also helps teach your body how to sit and function as well. Here's a friend of mine doing an exercise. These are just blog post links, so when you get the PowerPoint, you can click on them and read about it. All right, so what can you do now? Get up, don't sit for greater than, I wrote, get up every 60 to 90 minutes. So that's for people who are working. If you're older and you're at home watching TV or on the computer, I would get up a lot sooner than that. Okay. And walk around the house 5 minutes. Walk sideways. It's a great way to strengthen up your hips. Take a look at my ebooks on how to move and hold your posture throughout the day. All right, just to finish my story, Drew finished his Pleasant Prairie Triathlon. He got eighth in his age group. And that was a few years ago. Last year at Chicago, he was back and he took second in his age group in the sprint triathlon. So he embraced his journey, accepted where he was, he worked diligently, and he got back to what he's doing. And you never know what you can accomplish when you accept where you're at and you work with it. Acceptance doesn't mean giving up. Oh, there he is at last year's Chicago Triathlon. Okay, I'm going to stop sharing this. And if you have any questions, I think one of the questions that's very typical, that's a little housekeeping. People always want to know if we take Medicare. And yes, we do. We are Medicare providers. If you have Medicare, you do need a prescription from your doctor. If you are in a private health insurance, so you're under the ages, usually under 65, you do not need a prescription. So you can just come in and see us. So if most of the people on here, I saw some pictures, most of you look like they might, are older. If your adult children or grandchildren want to come in, they don't need a prescription. Um, but we send a note to the doctor to sign off on for Medicare. All right. Do we have any questions, Jasmine?
Yeah, it looks like Kitty asked in the chat, would love to hear more about shoes and support, whether they're brands, insoles, or good places to buy shoes.
Um, I am not married to a shoe brand. The best shoes for you could be a brand that's not the best shoes for me. So with that being said, I send people to one of two, three, four places. There's Fleet Feet in Deerfield. There's A Comfort in Arlington Heights. Waxburgs and Skokie's been around forever. They're used to dealing with difficult feet. If you don't necessarily have a difficult foot, then I would go to, but you can go to any of these, but Fleet Feet, they do a great job of determining. They look at your foot more three-dimensionally these days, so you figure out which shoe will work best for your foot volume. When you come in here, I'll take a look at your feet and we'll decide if maybe an orthotic is recommended or not. I've been wearing orthotics since my 30s. I'm now 63. I had big toe surgery a few years ago. I have some dysfunction in my feet. I need orthotics. So I'm not against them. With that being said, not everybody needs custom orthotics. Sometimes an over-the-counter will be just sufficient. That I don't know which one to recommend. The shoe stores are a little bit better on that.
Yeah,
However, if I think you need an orthotic, I usually like to work with people for 6 to 8 weeks because your body and your feet might be different at that time, and then I'll send you into the podiatrist to get them made.
So those would be more like custom orthotics.
If you go to the podiatrist, yeah, but depending on what we both see, a lot of people don't need it custom. An over the counter might be sufficient for a year or two. They last about a year.
Right. I'm in Naperville. I used to live up north, but I'm in Naperville now. And my son and I, he's in his 20s. We went to a store where I felt like they were good on fitting. It was kind of just a running shoes, a
Mhm.
specialized running shoe store.
Yeah,
But they had these orthotics where they sort of took a piece of pliable material and molded it to your foot and like
right.
heat molded it, but they were quite expensive. And I mean, they were $100 a pair, and I thought that was kind of outrageous for when you're paying a lot for a pair of shoes already. Um,
Well, I have to be honest with you, Kitty, that's actually not a bad price.
really? Okay, wow.
So if you're getting custom orthotics, they're going to be $600 or more.
What? Okay.
Now, insurance usually covers it,
Okay.
but you have to see. Like my podiatrist who I did my foot surgery with the health insurance I have currently, he's not in that plan, so I'm going to have to pay
Right.
$600 to get a new pair of orthotics.
Sure.
And then I also have a deductible, so I was going to pay 600 anyway.
Yeah, you're gonna pay it anyway.
And the ones that they mold, like at Roadrunner Sports, they're okay.
Yeah, that's it was
They're
Roadrunner, yeah.
okay. They're okay. They may be all right. So usually,
Hmm.
if someone comes in with them, I'll take a look at, is it actually doing what it's supposed to do for you? There's ways we can do some exercises. And over the
Hmm.
counter orthotics are 60 to $100. So
Wow. Okay.
there's
Is
a lot
there
that goes into making an orthotic. I've taken some classes, but there's a whole art and science behind it, and so I don't do that.
Sure.
It's complex.
Of course. Denise, there's a store out here called I think it's called the Good Feet or the Good Foot store. Have
Oh
you
yeah, I've
heard of
heard
that
about
one?
that.
And I
Um,
think they do like a three-stage orthotic where like they're kind of trying to, at least this is what I read on some advertising that they're trying to basically like realign your foot and your muscles to a healthier place. But I just wondered if you had heard of that at all.
I haven't.
Okay.
Someone mentioned the Good Feet store. I think it's a chain, and
I think it
something
is.
about it was pretty expensive. So I don't know. I'd have to,
Sure.
um, you know, typically, somebody who needs like a custom orthotic like me, I'm not getting it remolded every year.
How long do they
Podiatrists will tell
last?
you it's good forever, but I don't believe that because your body
No.
changes. However, something like that process, they'll do that with kids who have, neurological issues, and so they're growing and changing and whatnot. So they're going to
Hmm.
create a different kind of, and that's a pedorthotist might make that, and it's a different kind of orthotic. So
Okay. I
I
just was
would,
wondering because I injured my ankle a couple of years ago. I wasn't watching where I was going and the curb changed height and I tripped off the curb and it was very, very painful. And it's like uncomfortable to walk. Plus I have stenosis in my spine. So it's like I'm dealing with like kind of trying to balance out my different as I'm sure
yeah.
a lot of people are,
Well, did you go to physical therapy?
I need to go to physical therapy. I didn't at the time
Yeah,
because I
you,
was
you can
working.
go now because you need to
Yeah.
re-educate to get your foot working back with your back, and they can help you
Right.
decide. So I
Okay.
think we're finishing up here. It's 1 o'clock. Is there any other questions? Well, thank you for having me. I think I'm doing a talk about running next month. So if you have any runners
Yeah.
in your life, um, I work with runners a lot. So,
Hmm. Awesome.
all
Well, thank
right.
you as well. Have a good one,
All
everyone.
right.
Thank you so much for the time.
Thank
Hold
you.
on a second. Don't close. I gotta look at, okay. There's nothing I need to get in the chat box. All right. Thanks again, everyone. Thanks.